All right, welcome to The Explainer. Today we're diving into a topic that's, well, it's complicated. It sits right at this crossroads of medicine, politics, and honestly, a lot of hope. Should kids ever be prescribed medical cannabis?
So let's just put it out there. Could cannabis actually be a medicine for kids? For a lot of people, that idea, it just feels wrong, right? Or at the very least, super complicated. But this isn't just some hypothetical debate. Behind all the noise, there are real families asking this very question.
And look, we're not talking about some abstract ethical problem here. We're talking about kids with severe epilepsy, cancer, or autism. Situations where, the usual treatments just aren't working. And their families are looking for anything, absolutely anything, that could give them a better quality of life.
Okay, so to really get our heads around this, we've got to step away from the headlines and the opinions and actually look at what the science says.
And a brand new review, literally just published this month, from Leafwell and Duke University, did exactly that. They took a deep dive into 10 of the most recent studies to try and get a clearer picture of what's really going on, the benefits, the risks, for patients under 21.
Now, this part is absolutely critical. We have to be super clear about what we're talking about here. The stuff being studied in these medical settings, it is not what most people think of as cannabis. It's overwhelmingly high in CBD. That's the part that doesn't get you high, and really, really low in THC. This is a whole different world from recreational cannabis.
So, what did they find? Well, the results were surprisingly positive across the board. The researchers basically said that for certain conditions, these products could significantly improve the quality of life. And the strongest evidence by far was for kids with autism spectrum disorder.
And if you want a number to really see the impact, check this out. In one of the key studies on autism, a whopping 74.5% of the pediatric patients said their symptoms actually got better after the treatment. That's huge.
But, of course, it's never that simple, is it? Promising results are just one side of the coin. We also have to be really honest about the risks and, maybe more importantly, what we still just don't know.
Okay, so the good news is that the side effects they saw in these studies weren't all that scary. The most common things were drowsiness or maybe some changes in appetite, things the researchers called mild and manageable. But, and this is a big but, the researchers were also crystal clear about the limitations. The science we have right now, it has some major gaps, and that leaves some really big questions unanswered.
So what are we missing? Well, the biggest one is long-term safety data. We just don't have it. Plus, most of these studies were pretty small. They didn't have a control group to compare against, and there was no standard for dosing. The bottom line is scientists all agree. We need bigger, better, more rigorous research to get real answers.
And this is where things get messy, because this promising but still incomplete science runs headfirst into a very, very divided political world.
Just look at this timeline from a single week this month. It's wild. On one day, you have Republicans at the federal level blocking cannabis banking laws. The very next day, a top nominee for the Justice Department is calling cannabis a gateway drug. But at the exact same time, you've got states like Nebraska and South Carolina trying to expand medical access. It's a total mess.
And this quote, boring and smelly, it really gives you a taste of the opposition at the very top. This whole gateway drug idea is a really powerful political story, right? It frames any kind of cannabis use as dangerous no matter what the science actually says.
So what does all this political fighting lead to? A system that's just confusing and totally unfair. For those kids and families we started with, whether they can get a treatment that might change their lives doesn't come down to science. It comes down to their zip code.
Okay, this leads us to the big one. The number one fear that really drives so much of this political fight. The idea that if you legalize cannabis in any way, you're going to have teenagers using it everywhere. And you know what? It's a fair question. It's a concern that comes up in every single one of these debates. So let's look at the data. What do the federal government's own numbers say?
And the answer? Well, it surprises a lot of people. According to SAMHSA, that's a federal agency, the Substance Abuse and Mental Health Services Administration, since 2014, when the first legal sales started, cannabis use among teens has not gone up. In fact, it's actually dropped by 18%.
And this isn't just some fluke, some one-off study. This is what we see again and again. Legalizing for adults has not led to more teens using it. In fact, some data from Washington State even suggests that having a regulated market might make it harder for kids to get their hands on it.
And just look at who's behind this consensus. We're talking about the biggest public health agencies in the country: SAMHSA, JAMA, the CDC, the National Institute on Drug Abuse.
They're all seeing the same thing. The actual data just doesn't back up that political gateway drug story.
So, that brings us full circle, right back to where we started. On one hand, you have this emerging science showing real, genuine promise for some of the most vulnerable kids out there. You have hard data that seems to put the biggest public fear to rest. And on the other hand, a political logjam. It leaves us with this one final, really tough question. In a world like this, what's the path forward for the patients who are stuck right in the middle?